Nursing informatics is a critical field that leverages technology and data to enhance healthcare delivery, patient outcomes, and the nursing profession. This presentation explores the role of nursing informatics leadership, focusing on nurse scheduling systems, credentialing systems, and the broader impact of informatics on the healthcare industry.
Leadership competencies in nursing informatics explores the ethical and management issues related to using computers and technology. Specific competencies include accountability, client privacy, and confidentiality and quality assurance in documentation. And for user level leadership competencies, we have recording and administrative data. So, utilizing computerized management systems for recording, billing, quality assurance, workload, and other administrative data. 2. Structured data entry. Using applications for structured data entry, including classification systems and acuity levels. 3. Understanding the client's rights. So, we nurses obviously have ingrained in our mind all the patient's rights. So this is done so we can recognize and respect the client's rights related to computerized information, ensuring again privacy and confidentiality. So what is the nurses involvement in information system? So nurses play a crucial role in the planning, design, choice, and implementation of information systems in the practice environment. Their input ensures that the systems are friendly for the user, efficient, and aligned with patient care needs. So, ethics in nursing informatics. So, incorporating a code of ethics in relation to client privacy and confidentiality. So, this is done to uphold the ethical standards in the use of technology to protect patient information and ensure trust in healthcare delivery. So, in conclusion, leadership competencies in nursing informatics are essential for nurses to effectively utilize technology in their practice. By understanding and implementing these competencies, nurses can enhance patient care, improve documentation processes, and contribute to the advancement of healthcare technology. Thank you.
So the second one is modifier level leadership competences. So these are four level. First is awareness of the role of nursing informatics and health informatics and information systems. So this competency involves understanding the significance of nursing informatics within the broader context of health informatics and information systems. So the second one is participation in policy and procedural development related to nursing informatics. So this competency means actively contributing to the creation and refinement of policies and procedures specific to nursing informatics. So the third one is evaluation of information system and in practice settings. So this competency involves assessing the effectiveness and usability of information systems used in nursing practice. For the last one is analysis of ergonomic integrity for technological apparatus in practice. So this competency means examining the design and functionality of technology tools to ensure they are ergonomically sound and suitable for nursing practice. So for example, a healthcare supervisor reviews the design of computer workstations and mobile devices used by nurses, ensuring they are comfortable and user-friendly to prevent musculoskeletal issues and enhance productivity. So the last level is innovator level leadership competences. So these are three level. First level is participation in quality assurance programs using information systems. So this competency involves actively engaging in quality assurance programs that utilize information systems to monitor and improve patient care. So the second one is ergonomic design of workstations, bedside access stations, and portable apparatus equipment. So this competency means ensuring that technology tools and equipment used by nursing staff are ergonomically designed to enhance comfort, safety, and efficiency. So the last one is of societal and technological trends and new developments applying them to nursing. So this competency involves staying informed about current societal and technological trends and integrating them into nursing practices to improve patient care and outcomes.
Nurse scheduling and credentialing systems are vital components of healthcare operations management, ensuring efficient staffing and compliance with professional standards. So kini na systems kay ginagamit para mapadali ang trabaho sa mga healthcare providers, especially when it comes sa nursing scheduling and credentialing systems. So gina-utilize nila ni for the efficiency of their work. First is the nurse scheduling system. Ang nurse scheduling system is the system or software applications designed to streamline the process of assigning shifts to nursing staff within healthcare facilities such as hospitals, clinics, and long-term care facilities. So natay features o purpose sa nurse scheduling system. First is let's discuss the features of the nurse scheduling system. We have here the automated scheduling algorithms. So these systems use algorithms to generate optimized schedule based on predefined criteria such as staff availability, skill requirements, and workload distribution. Another is shift swapping capabilities. So nurses can request shift swaps with their colleagues through the system, which facilitates flexibility and allows for better work-life balance. Another is the integration with HR systems. So integration with human resources or HR systems enables seamless sharing of employees' data, including work hours, leave requests, and payroll informations. Another is real-time updates. Well, nurses and managers can access schedules and make changes in real time, ensuring that everyone has up to date information. Now, for the last features for the nurse scheduling system is the reporting and analytics. So these systems provide reporting tools to track key metrics such as overtime costs, staffing ratios, and compliance with scheduling policies, enabling data-driven decision making. And now let's move on to the purpose of the nurse scheduling system. First is we have the efficiency. So these systems aim to improve efficiency by automating the scheduling process. So reducing time and effort required by nurse managers to create and manage schedules manually. Another is the staffing optimization. Well, by analyzing factors such as staff availability, skills mix, and patients' needs, these systems help ensure adequate staffing levels across different shifts and units. Another is the conflict resolution. Well, nurse scheduling systems incorporate features like shift swapping and request management to address scheduling shifts, conflicts, and accommodate staff preferences. And lastly is the compliance, of course. So they help ensure compliance with labor regulations, unions rules, and institutional policies regarding work hours, breaks, and overtime. Now we are down to the nurse scheduling system in the Philippines. So we have the Nurse Deploy PH as one of the nurse scheduling system that have been utilized by the Department of Health. So ang Nurse Deploy PH is a nurse deployment program implemented by the Department of Health, DOH, in the Philippines, which utilizes a digital platform for scheduling and deploying nurses to various healthcare facilities across the country. So gina-utilize nila ang Deploy PH para to have the another healthcare providers at especially the nurses para ma-deploy sila sa various facilities across the country. So instead of using traditional way, so they can just use the system for the efficiency of their work. So they can utilize the nurse deploy PH. So that's all. Thank you.
Nurse credentialing systems. So, nurse credentialing systems are software platforms that are used to manage the verification of qualifications, licenses, certification, and other credentials for healthcare professionals, including the nurses. So, it has its key features. In this system, we have verification of education, in which the credentialing system they would verify the education credentials of healthcare professionals, including their degrees, diplomas, and certifications from accredited institutions. We also have licensure verification, in which they would validate the professional licenses that held by the healthcare providers, ensuring that they are in good standing with regulatory authorities. Another key features of this system is the certification verification, in which the credentialing system they would confirm that the healthcare professionals hold relevant certifications in their specialty areas, such as advanced practice nursing certifications or specialty nursing certifications. We also have its key features such as the background checks. So some systems they would include background check functionalities to screen for criminal history, sanctions, or disciplinary actions against the healthcare providers. We also have its key features ongoing monitoring, in which the credentialing systems may also monitor and track the expiration dates of those licenses and certifications, and they would send alerts when the renewal is required to maintain the compliance. So that's the key features of the credentialing system. We have here the purposes of the nurse credentialing system, in which we have regulatory compliance, in which these systems they would ensure that the healthcare providers they would meet the regulatory requirements that are set by the government agencies, professional boards, and accrediting bodies. It is also used for patient safety by verifying the credentials of the healthcare professionals. The credentialing systems they would help maintain the patient safety standards and mitigate the risk of malpractice. We also have institutional reputation, in which the credentialing systems they would contribute to the reputation of healthcare organizations by providing or demonstrating their commitment to employing the qualified and competent staff. And lastly is the efficiency, in which they would streamline the credentialing process, reducing the time and the resources required for onboarding new staff and maintaining compliance with credentialing standards. So we really have a lot of benefits in using this nurse credentialing systems, because by verifying the qualifications and credentials of the healthcare professionals, credentialing systems they would help to ensure that the patients receive care from competent and qualified providers, and reducing the risk of medical errors and adverse events. And these systems they would streamline the onboarding process for new hires by automating the credential verifications and reducing the paperwork, allowing the healthcare organizations to fill vacancies more quickly. Here I've provided a nurse credentialing system here in the Philippines, in which we have here the Philippine Nurse Licensure Examination or PNLE system. So the Philippine Nurse Licensure Examination or PNLE system, it is a digital platform that managed by the Professional Regulation Commission or the PRC of the Philippines, which they would oversee the licensure and regulation of nurses in the country. So the PNLE system, they would facilitate online registration for nurse licensure examinations, verification of the nursing credentials, and issuance of the professional licenses to qualified candidates. So it maintains a database of licensed nurses and provides a platform for employers to verify the credentials of the registered nurses. So the PNLE systems, it really streamlines the licensure process for nurses, reducing paperwork and processing times and ensuring the accuracy and integrity of the licensure records. Nurse scheduling and credentialing systems, they really play a crucial role in optimizing staffing resources, ensuring regulatory compliance, and enhancing patient safety within the healthcare organizations. By leveraging technology and automation, these systems improve efficiency, reduce the administrative burden, and support better outcomes for both staff and patients.
Next, we are down to the informatics and healthcare industry. So, healthcare informatics, also known as the health informatics of medical informatics, is the interdisciplinary field that involves the application of information technology, data sciences, and the computer science principles to healthcare delivery, management, research, and education. So we have four rules of informatics in the healthcare industry. So first we have data management and analysis. So informatics plays a crucial role in managing and analyzing vast amounts of healthcare data, including electronic healthcare records, or also known as EHRs, and medical imaging genomic data. We also have administrative records. So these advanced data analytics techniques such as machine learning and natural language processing, enable healthcare organizations to derive insights from data to support clinical decision making, quality improvement initiatives, and population health management. Next, we have clinical decision support. So, informatics system provide clinical decision support tools that assist healthcare providers in making evidence-based decisions at the point of care. So, these tools may include alerts and reminders for medication interactions, clinical guidelines and protocols. We also have diagnostic assistance and predictive analytics for identifying high-risk patients or predicting disease progression. Next, we have telemedicine and telehealth. So informatics technologies facilitate the delivery of telemedicine and telehealth services. So enabling remote consultation, virtual visits, remote patient monitoring, and telehealth education and training. So telemedicine platforms leverage video conferencing, secure messaging, and mobile health application to extend healthcare access to underserved population. So this improve care coordination and reduce healthcare disparities. Next and last is Health Information Exchange, or also known as HIE. So informatics enables the seamless exchange of health information among healthcare providers, patients, and other stakeholders through Health Information Exchange, or HIE. So HIA facilitates interoperability and data sharing across disparate healthcare systems, improving care coordination, patient safety, and population health outcomes. On the other hand, there are challenges in informatics and the healthcare industry. So first of that is the interoperability. So achieving seamless interoperability and data exchange among different health information systems remains a significant challenge in healthcare informatics. So variations in data standards, formats, and terminology hinder the exchange of health information across disparate systems, leading to fragmentation of care and inefficiency in care delivery. Next of that is the data security and privacy. So protecting the security and privacy of sensitive health information is paramount in healthcare informatics. Concerns about data breaches, cybersecurity threats, unauthorized access. We also have compliance with data protection regulations such as the Health Insurance Portability and Accountability Act, or also known as HEPA in the United States. So pose challenges for the healthcare organization in safeguarding patient data. Next is health information technology adaptation and usability. So adaptation of health information technology, or HIT systems such as electronic health records, or AHRs, and clinical decision support systems requires a significant investment in infrastructure, training, and change and management. So usability issues, poor user interface design, and workflow disruption may impede the adoption and acceptance of HIT system by healthcare providers, so leading to suboptimal use and dissatisfactory. Lastly, we have data quality and integrity. So ensuring the accuracy, completeness, reliability of health data is essential for effective decision making and patient care. So challenges related to data quality such as missing or erroneous data, data duplication, and data inconsistency pose barriers to data-driven initiatives, clinical research, and population health management efforts. But despite these challenges, healthcare informatics continues to advance and transform the healthcare industry, driving innovation, improving patient outcomes, and enhancing the efficiency and effectiveness of healthcare delivery. Collaborative effort among healthcare providers, technology vendors, policymakers, and regulatory agencies are essential for addressing these challenges and realizing the full potential of informatics in improving health and healthcare worldwide. So, in summary, the nurse scheduling systems are designed to efficiently manage nursing schedules and shifts within healthcare settings. These systems utilize technology to streamline the scheduling process, ensuring adequate staffing levels and optimal allocation of resources by automating scheduling tasks and providing real-time updates. Nurse scheduling system also help to minimize the staffing gaps, reduce administrative burden, and ultimately enhance patient care delivery. On the other hand, the nurse credentialing systems are integral to ensuring the verification and maintenance of nurse qualification and credentials within healthcare organizations. So this system employs standardized process to verify licenses, certificates, education, and other credentials required for nursing practice. By centralizing and automating credentialing procedures, they help to ensure compliance with regulatory standards, promote staff competence, and enhance patient safety. Additionally, nurse credentialing system facilitate the ongoing monitoring and updating of credentials to ensure nurses remain qualified and competent throughout their careers. And lastly, the informatics and the healthcare industry optimize healthcare operations by using the data and technology to streamline processes and improve communications and enhance decision making. So it integrates electronic health records, telemedicine, and data analytics to support clinical workflows, reduce costs, and improve patient outcome.